All right, everybody, we're going to start our first insulin video with just some general tips that you're going to do for all of the different scenarios. And then we're going to do one video for each scenario. They're going to be really quick, though, because you already know how to do med tasks. You already know, all of the steps of this. It's just going to be the insulin portion of it that we're really going to work through. So when we're getting ready to do insulin, of course, knowing, is it a basal dose? Is it a correctional dose? Is it a nutritional dose? Is very important, because we need to understand, does the patient need to eat? Do they need to have food? Is this going to correct a BG that's already there? Then that doesn't have regards to food. Is it is it a nutritional dose that we're giving to our patients in anticipation of them eating? Well, then they have to eat, or they're going to become hypoglycemic. You're going to need to still know your onsets, your peaks, and duration. Any of those are fair game during the comp to be asked, and you need to verbalize, this is going to have an onset of 5 or 15 minutes, so I'm going to be watching my patient closely for hypoglycemia. If it's more of an intermediate or a long acting, we're really looking at that peak, because that's when they're most at risk and those medications to have an episode of hypoglycemia. There's a couple of papers posted on Blackboard. One is this insulin administration, just some general rules. You're only going to use insulin syringes, so know that your insulin syringes are down in this bottom drawer. They're in a box labeled insulin syringes. They're orange, and stay right on it that they're an insulin syringe. There is different sizes of insulin syringes. That, again, we talked about this in class. There's one that's going to hold 100 units. There's one that's this one holds 100 units. Okay, it says, it says that right on here. If you're looking at the syringe, it's going to say right on there, it goes up to 100. Then there's one that goes to 50, so that one is 50. And then there's one that goes to 30. So you're going to pick the one that's going to give you the most precise. So if you need less than 30 units, you're going to use one that's for 30. If you need between 30 and 50, you'll use a 50. If you need greater than 50, then your only option is to use 100. We only give insulin in insulin syringes. So you're not going to try to give it in any other type of syringe. That's going to be an automatic failure. These are down in the bottom drawer. There's no needles, so you're not going to draw up with one needle and change the needle. It's all one syringe and needle, so you're going to use the same one to draw it up as you are to give it. They're tiny little needles. They're super sharp. You don't have to worry about them dulling as much as your bigger needles. So your insulin vials are also going to be in these MAR carts. They're not in the MDU stations, so you don't need to go over to the MDU stations at all. You're going to do everything right from this cart. So, of course, you need keys to unlock your cart. That's going to be part of your comp. In this drawer, there's a whole slew of insulin. There's one U500 concentration. You need to make sure you do not use that for your comp. It's got these little marks on the side, and it says, of course, U500 right on it. 500 units per milliliter. That's 5 times as strong as the other insulins that are in this drawer. So you want to make sure you don't pick that. If you pick that and give it, you're giving the wrong dosage. 5 times as much dosage as you need to your patient. So then there's all of the other ones in here. There's combinations, there's regular, there's Lispro, there's NPH, there's Lantus, there's Detamir. There's all sorts of insulins in here, so you have to be cautious in picking what you need. Make sure that you know what you need to give. If you have to mix insulins, most typically that's regular and NPH that you're mixing, you need to give the same brand. So these are 2 different brands of NPH. You see, one is Humulin and one is Novolin. So if you needed to mix this, say you wanted to give this Humulin NPH, then you would need to get the Humulin R to go along with it. If you picked something else, that's going to be considered a failure. So make sure you have the same brands when you're mixing your insulins. These are always going to be given sub-Q, so you need to pick an appropriate site. Back of the arm, stomach, or the thigh. Of course, same rules apply. You're going to pinch an inch. You're going to scrub for 15 seconds. You're going to go at 45 to 90 degrees into your patient. You need to be wearing gloves during that time. All of those general principles of medication administrations are also considered failures. So make sure you know what they are. You're prepped, and if you do any of those wrong, it's also going to be considered a failure, on top of knowing the details about insulins. The other things that are on this sheet are know your patient's blood glucose when giving insulin. So you're going to ask what the blood glucose is, or your comp card is going to tell you what it is. If it's ordered on a sliding scale, which is considered a correctional dose, you're going to give as directed, regardless of food intake or NPO status. If it's a nutritional dose, then of course you're going to make sure you know when your patient needs to eat. If it's Lispro or fast acting, they should actually have the food right at the bedside with them. If it's short acting, your regular insulin, then you have 30 minutes to get them some food. Make sure you know what insulins can be mixed and can't be mixed. You cannot mix pre-mixed insulins. And what that means is here's a Novolin 70/30 that's already mixed. You can't mix that with anything else. You also can't mix your long acting. So if you have to give a short acting or a rapid acting and a long acting, you have to give your patient then 2 separate injections. So make sure you know that. You can, of course, mix your rapid acting insulins with your intermediate acting insulins, which is the most common thing we mix. Insulin Apidria is the only one that takes note on here, can only be mixed with NPH, but most typically that's what we're doing anyways. This also shows you some common injection sites, talks about absorption rates. Make sure you just have read this. Know that the only thing we give IV is regular insulin, but you're not giving anything IV here. You're only giving insulin subcutaneous. The other document that's on there then is the step-by-step checklist. So use this, print it, bring it, practice. Now it doesn't go through every potential comp step-by-step because the comps are just different scenarios of giving insulin. So this walks you through how to give one insulin injection and draw it up, or it talks about mixing because you're going to have to do some combination of that for each comp. Okay, so I think that wraps this one up, and we'll move on to the next.